Hello, my name is Bryce Barker. I'm a senior knowledge broker at the Canadian Centre on Substance Use and Addiction. In the next few minutes, I'll walk you through Canada's guidance on alcohol and health. We worked with a panel of 22 experts from 17 organizations across Canada to develop Canada's guidance on alcohol and health. The final report was released in January of 2023. The overall key message of the guidance is to reduce the risk of harm from alcohol. It is recommended that people living in Canada consider reducing their alcohol use. If you want a shorter message, consider cutting back would be it. Or as our colleagues in Prince Edward Island put it in their provincial campaign, less is best. The guidance offers practical tips to help people cut back on drinking. These include tracking how many drinks you have each week, sticking to the limits you've set for yourself, drinking slowly, drinking lots of water, for every drink of alcohol, having one non-alcoholic drink, choosing alcohol-free or low-alcohol beverages, eating before and while you're drinking, having alcohol-free weeks, or doing alcohol-free activities. For what follows, it's important to understand that when we refer to a drink or a standard drink in Canada, we mean 341 milliliters of beer, that's 5% alcohol, coolers, ciders, or ready-to-drink cocktails that are 341 milliliters and 5% alcohol, 142 milliliters or a medium-sized glass of wine at 12% alcohol, or 43 milliliters or 1.5 ounces of spirits at 40% alcohol. As noted, encouraging people to explore lower or non-alcoholic drinks can be helpful in cutting back. Based on the latest evidence, we outlined the risks associated with weekly alcohol use. There is no risk at 0 drinks per week and potential benefits such as better sleep and overall health. Low risk at 1 to 2 standard drinks per week, avoiding most of the short and long-term consequences for yourself and others. Moderate risk at 3 to 6 standard drinks per week, increasing the risk of alcohol-related cancers and other consequences from drinking alcohol. And finally, increasingly high risk for health and other consequences of drinking at 7 or more standard drinks per week. We recommend consulting the guidance final report available on our website to learn more about alcohol and risk. When we talk about risk from alcohol over the time frame of any given week, the guidance also notes that consuming more than 2 standard drinks on any one occasion increases the short-term risks of harms to yourself and to other people, including the risk of injuries and violence. The guidance also notes circumstances where 0 is the most reasonable number of alcoholic drinks to consume. These circumstances include driving a motor vehicle or using machinery and tools, taking medication or drugs that can interact with alcohol, doing any dangerous physical activity, taking care of others, or making important decisions. Similarly, for people who are pregnant, planning to be pregnant, or breastfeeding, the safest option is to avoid alcohol completely. Young people under the legal drinking age are encouraged to delay their drinking as long as possible, as alcohol is a leading cause of death and social problems for this group. Intoxication in young people is associated with higher risks of injury, aggression and violence, dating violence, and worsening academic performance. The guidance highlights sex and gender-based differences. At 7 or more drinks per week, health risks increase more dramatically for females than for males. However, the guidance also notes that far more injuries, violence, and deaths result from men's alcohol use, especially when drinking higher risk amounts on any given occasion. Since the release of the guidance, CCSA and colleagues have published several academic articles, and the approach and methodology of the guidance have gained international recognition. Beyond publication, CCSA also led efforts to ensure that the knowledge contained in the guidance gets used across Canada. We continue to develop and share practical resources. We are collaborating with organizations interested in sharing the guidance and have engaged with partners through regional roundtables across Canada to better understand their needs and to strengthen our partnerships. Campaign resources are available at drinklesslivemore.ca. We're honored that partners across Canada have used and adapted them to support their local conversations. We also partnered with colleagues at the University of Victoria who took the lead on developing the No Alcohol website, where individuals can explore how alcohol impacts their finances, nutrition, and long-term health, and reflect on what making a change might mean for them. Please don't hesitate to reach out to us if you have any questions or if there are any opportunities to work together with our team. Thanks so much.